I've now been joined on the program by our guest, a professor of pediatrics at the College of Medicine, University of Lagos, and a consultant neonatologist at the Lagos University Teaching Hospital, LUTH. She's the current president of the Nigerian Society of Neonatal Medicine and also a member of the Stop ROP Blindness in Africa group. Professor Iretiola Fajolu, thank you so much for being with us.
Thank you very much for having me.
Okay, so preterm babies are described as babies that are born before 37 weeks of full gestation.
Yeah.
Why are they in so much hurry to come out?
That's the question we ask them, really. But a preterm baby is a baby who is born before 37 completed weeks of gestation. Normal term is 40 weeks gestation. So they've come out, some of them as early as 28 weeks. So some of them are coming out about 3 months even before their due time. The cause of prematurity is really not known, but there are a lot of risk factors that have been associated with preterm births, ranging from maternal illnesses, hypertension in the mother, smoking, alcohol ingestion, drug ingestion in the mother, maternal ill health in general, and sometimes the babies also have some problems in utero, and because of that, they need to be delivered early. So sometimes the physician-induced preterm delivery because the baby's life is being threatened inside the womb, so they need to come out early to give them an increased chance at survival. However, we've said that for mothers, when you are pregnant, it's important that you go to register early for antenatal care in a hospital where you can be adequately taken care of. So that has been shown to reduce the risk of you delivering preterm. And if by chance that cannot be prevented, then you know you are in the right place where your baby and you yourself can be properly looked after even after the preterm births.
So weight gain, I think you mentioned that, alcohol, some medical conditions in the mothers. What would be that kind of medical condition?
Like hypertension in the mother, it's one of the major causes of early delivery, because if the mothers have severe hypertension in pregnancy, the baby needs to come out. Okay, and that itself may push the baby out earlier. Infection in the mothers. So if they have an infection, that can cause a breakdown of the membrane where the baby is being carried in, and that results in inevitable preterm delivery. Cardiac diseases, other medical conditions in the mother can also cause preterm delivery.
And that's why antenatal is very, very important. So
yes.
Let's talk about that. At what point should a pregnant woman start antenatal?
For us as neonatologists, we say immediately you know you're pregnant, you must start your antenatal care. However, even that may be late, because many mothers will know they are pregnant maybe after they miss their first period. So that's 4 weeks gone into that pregnancy. For development, most of the organs are developed by 6 weeks of life. Okay, so whatever problem might occur would have occurred before they even go to register. But we say go and register as early as possible. Within the first 6 weeks of that pregnancy, you should actually go and register for antenatal care. I'll talk about something that is not exactly related to ROP that we're looking at, but mothers or women in the childbearing age, we say we want them to have enough folic acid in their system. Okay, so even before you get pregnant, you should have enough folic acid. So use folic acid if you are planning to get pregnant, so that by the time you know you are pregnant and the organs have already been formed, you are in a good folic acid place, yes.
For that baby to come out right. So you said as soon as, prenatal. If you know that you're planning to have a baby, you should start at that time. And then the next best time is as soon as you know.
As soon as you know.
As
soon as you know. We see a lot of mothers coming to register 3 months, 4 months, 5 months. By then, if there's going to be a problem, the problem will have started. And when I'm talking about these problems, abnormalities that may develop, babies that can be born with abnormalities. I'm talking about that majorly. But even for the preterm delivery as well, if the mother is hypertensive and is picked up early, then management can start early, and that can prevent preterm birth later on.
Now, let's talk about some of the complications that can arise as a result of a child being born preterm. We talk about the blindness that could have happened to that child. So let's narrow it down to that, but tell us more about some other areas that, complications can arise for that child.
So a preterm baby is born before term. So the organs are all immature. So all the systems can actually be affected because of that immaturity. They're not ready to start fending for themselves, if I can use that word. So inside the womb, the placenta does all the work for them. Breathing, metabolism, excretion, and all that is done by the placenta. But they are now delivered earlier than they should have been delivered. So they are now left alone without the placenta to fend for themselves. So they need to keep warm. One of the major problems, I'll talk about the immediate problems that preterm babies will have. Respiratory problems. They are unable to sustain breathing properly because they do not have mature lungs, and also because they lack something we call surfactants, which is also in the lungs that helps them to breathe well. So they have breathing problems. They can't keep themselves warm because they're very tiny. They don't have enough fat to keep warm. So warmth is a problem. Feeding is also a problem. Most of them cannot even suck the breast. So you need to find a way.
They're not strong enough to do that.
They're not strong enough to do that. Feeding, infections, because they're also very prone to having infections. Their immune system is not properly developed. So they are prone to having infection. They are prone to having anemia, that is low blood level. They are prone to having jaundice, which is yellowish discoloration of the eyes and the skin. And with jaundice, they are more likely to have brain damage from jaundice if it is not identified early and treated properly. Those are some of the immediate complications that they can have. Then later on, we'll talk about the retinopathy of prematurity. We'll talk a little bit more about that.
Yes,
later.
We want to narrow it down to that.
They can have chronic lung problems, that is, lung problems, even after they've been discharged from the neonatal unit, they end up with chronic lung problems. They may have disabilities, cerebral palsy. They may have hearing defects, blindness. They are prone to abuse because they've been in hospital. Some of them are in hospital for 3 months plus. Then they get home and the baby is now sick. The mother is like, come off it. I'm not going back to the hospital. And, they go through a lot because of being born early, born too soon.
So how do we help them, How do we help children who are born before their time, if I could put it that way?
So let's start with delivery. So once there's an imminent delivery, you talk about trying to prevent them coming out early by the mothers going for antenatal care. However, if preterm birth is imminent, then that mother and the baby still in the womb should be referred to a facility where she can be delivered, and both the mother and the baby can be properly looked after in that facility. What we have in some cases is that they are delivered in a different facility. Then they say, oh, we can't manage this baby, and they say refer to another hospital. So you are carrying this baby, who is very fragile, in a wrapper and all the way down to another hospital. By the time they get to that hospital, they are cold. They don't have enough blood sugar. They may be having convulsions, and so many other problems will have set in before they get to that facility. So we're saying that these babies should be referred still in the womb to a facility where they can be properly looked after. And at that facility, when they come out, then the doctors there know what to do, right from the delivery room, how to resuscitate them if they need resuscitation, using the appropriate amount of oxygen, making sure that they care for them, looking out for all the complications that they may have, and caring for them all the way. And also screening, looking out for other complications that they may have that can affect them in future. Because we're not just looking at them surviving, we're talking about them thriving as well, so that they can have a near normal life or in normal life, actually.
And we see most of them, you know, doing very well.
Yes.
We do see
if
them.
I tell you that Albert Einstein was born premature, Charles Darwin was born premature, and they've done so much in the world of science. So they do well if we're able to give them that strong start.
From the very beginning.
From the very beginning.
And you say, if you already know, maybe right from when the baby is still in the womb, so that they don't come out where you'll be taking them. But we all know that we have challenges when it comes to care for, you know, particularly this newborn that we're talking about. But we'll talk more about that and how to make sure that preterm babies stay alive and stay well. After this break, we'll go on a very, very quick break and be back on Health Matters. Welcome back. You're watching Health Matters on Channels Television, and we're talking about how to prevent blindness in preterm babies. And we have in the studio with us a professor of pediatrics. Thank you so much for staying on with us. You were talking about the fact that, yes, to help some of these children, even right from when they're still in the womb, the mother can present into hospitals that would have all of those facilities to use. But we know in reality that we do not have as much as we should have. What other thing can be done in terms of preparing for a child that is, you know, whether you like it or not, coming out as a preterm baby?
Okay, so let's start with respiratory support. Like I said, is one of the problems, even before they are delivered. So that mother is contracting, and you know that this baby is going to come out, no matter what you do. There's something we call prenatal steroids. The mother is given an injection, which is a steroid, to help the baby's lung mature. Okay, so that doctor, even before referring, can start the steroid and write that I've given steroid at this particular time, the dose, and refer to that facility. So that steroid helps in lung maturity. Then the baby is delivered. We talked about keeping them warm. It has now been shown that what we call kangaroo mother care, which is skin to skin with baby and mother, has been shown to help them keep their warmth even much better than the incubator does, because it has many other benefits. It helps with breastfeeding, it helps with bonding and all that. So before, what we used to do was, when the babies are more stable, we now start kangaroo mother care. But a study done by WHO has shown that immediate kangaroo mother care is even better than having to start kangaroo mother care later. So we're saying this mother, as soon as she delivers a preterm baby, will keep the baby skin to skin with the mother and keep that baby there, and that improves warmth. So provides thermal care for that baby. If the mother is ill and is unable to do this, then a surrogate is allowed. Fathers, so some people have said that we should stop calling this kangaroo mother care and we should call it kangaroo father or kangaroo parents care.
Okay.
Fathers, grandmothers,
can also help out.
Can help us
we have a caller, yes. Paul. Yes, thank you for joining us. Go ahead with your question or comment.
Yes, I just want to ask you a brief question. Although I didn't, listen to your program on time, I just came now and I want to ask you, what's the cause of blindness in children? What causes the blindness? When a little kid is blind, what is actually the cause of that? That's what I want to know from you. Thank you very much.
Paul. Blindness in children, I guess, generally, but I'm sure perhaps it's something that could have started from when the child is born.
So there are many causes of blindness, cataracts. But if we talk about preterm babies, then retinopathy of prematurity is probably the largest cause of blindness in these babies. And it starts right from when they were born, and because something wasn't done. But for some other babies, it may be because they had cataracts, they had some other vision problems. So if a child is having a squint, for instance, and is not picked up early, it may result in some vision loss in that child. And some other children may have some more serious conditions like cancers in the eyes that are not picked up early, and of course that child would most likely lose that eye. So then injuries also can
and
cause
such
that.
child should be taken to the hospital for screening.
Early.
Okay.
Yes.
We are winding down. What will be the message that you want to leave as you go, particularly in terms of promoting healthy pregnancy and making sure that even if the baby is born preterm, they get the right help that they need?
So the message I want to pass on to our mothers is that pregnancy should not just come. You should plan the pregnancies. So if you're planning to get pregnant, start your folic acids. Once you know you are pregnant, go and register immediately for antenatal care in a hospital. Okay, we see some mothers go to traditional birth attendants and they say they've registered there, and sometimes the care they get is not optimal. Go and register in a hospital, follow your doctor's instructions, use your drugs as they are prescribed, and also to know that pregnant mothers should not use unprescribed medications, because that can also cause problems for these babies. And when it is time for delivery, then you need to go to a proper hospital for that delivery, such that your baby and you yourself can have a good outcome at the end of the day. So once your baby is being delivered, let's look at the preterm baby who we're focusing on today. If your baby is delivered in a hospital where the baby can be looked after, then of course you have no problems. However, you have a right and a duty as the mother to engage your doctors, to let them know what they are doing for your baby, how your baby is doing, and they should answer you and give you information. And talking about blindness and retinopathy of prematurity, every preterm baby who is born before 34 weeks of gestation, we've recommended that such babies need to be screened. So their eyes are looked at, because like I said, retinopathy of prematurity is not something that you see.
It's something that we need to screen. Let's quickly take this last caller from Akure, Al-Qadri.
Yes.
Go ahead, please.
Okay, I want to ask the doctor, in case if woman is having fallopian tube blockage, what can he do to get pregnant?
Mr. Al-Qadri, I'm sure we would have to talk about that topic another day. Today we are talking about preventing blindness in preterm babies. I will just note that down. I will talk about that another time. So we have to just say thank you. Thank you so much, Professor, for coming on the show. We've been having a chat with a professor of pediatrics at the College of Medicine, University of Lagos, who is also a consultant neonatologist at the Lagos University Teaching Hospital. Professor Iritiola.
Can I just say one last word? So for mothers within Lagos, Abuja, Ibadan, we have a program which is the SIBA program, the Stop Infant Blindness in Africa program. We've been assisted by that program, which is formed by the American Association of Pediatric Ophthalmologists and Strabismus and the International Council on Pediatric Ophthalmology and Strabismus. So we've been given some cameras that can help us look at the back of the eyes of these babies. And we have a phone number, which I'll probably give to you, and you can share some time during the program, where you could send WhatsApp messages if your hospital cannot screen, and we can help you book an appointment for these babies to have their eyes screened early enough to detect
to prevent blindness
and prevent blindness.
Thank you so much, Professor Iritiola Fajolu. Thank you for your time on the show.
Thank you.
And we're not done yet on Health Matters. Let's bring you up to speed with the latest stories from our news corner.
All all is not well in Nigeria's health sector as the Joint Health Sector Unions, JOHESU, has commenced an indefinite strike action with effect from midnight of November 14th, 2025 until the implementation of the adjusted consolidated health salary structure. The national chairman of the Medical and Health Workers Union, Comrade Kabiru Minjibri, says government has made no efforts to reach an agreement with the unions.
It may interest you to know that JOHESU, as contained in the Labour Act, writes and has informed the federal government of 15 days ultimatum before we come to this stage of summoning expanded National Executive Council meeting. But unfortunately, in their usual manner, they have not called for any conciliation meeting until yesterday. That is at the eve of the strike action. For the 13 days, government deems it unnecessary to call the leadership of JOHESU. And JOHESU have been very patient for all these years.
Already, healthcare services in government health facilities have been skeletal owing to an indefinite industrial action by the Nigerian Association of Resident Doctors, which began on November 1, 2025. As the world marks Diabetes Day, the World Health Organization, WHO, is reminding everyone that diabetes can affect people at every stage of life, emphasizing that from childhood to older age, diabetes prevention and care efforts must be integrated across every stage with supportive environments and policies that promote health, dignity, and self-management. Diabetes is a chronic disease where high levels of blood glucose or sugar occur because the body either doesn't produce enough insulin or can't effectively use the insulin it makes. This year's campaign, with the theme Diabetes Across Life Stages, emphasizes the importance of a life course approach to diabetes prevention, management, and overall well-being. The Lagos State Health Management Agency has flagged off the rural health scheme at the Agboyi-Oriomi community in the Agboyi-Ketu Local Council Development Area. The program, under the Eco-Social Health Alliance Rural Health Insurance Initiative, targets residents in hard-to-reach communities. Through the initiative, LASHMA will deploy mobile clinics and ambulances to communities 3 times weekly, complemented by partnerships with local tricycle operators to provide free emergency transportation for patients in need of urgent care. The pilot phase of the project will go around 5 communities across the 3 senatorial districts of Lagos: Agboyi, Oriomi, and Agboyi-Ketu LCDA, Ibaoloja in Ibejuleki local government area, Lafiaji and Okwaja in Otiosa local government area, and Boglo in Badagry. Speaking at the flag off, the permanent secretary of LASHMA, Dr. Emanuela Zamba, described the event as a historic milestone in the journey towards universal health coverage in Lagos State.
This initiative reinforces our collective resolve that no one should be left behind in the journey towards universal health coverage, whether residents who can afford the premium of the Lera Eco Health Insurance Plan, which is the most affordable in the state, or the vulnerable who cannot. It is not a program that is to run indefinitely. It is meant to provide succor for those residents in the absence of health facilities.
To enhance healthcare delivery in Kogi State, the federal government has commissioned 80 revitalized primary health care facilities and handed over essential medical equipment and commodities to the state government. The commissioning ceremony held at the Government House, Lokoja, was attended by Governor Usman Ododo, the Executive Director of the National Primary Health Care Development Agency, Dr. Mui Aino, senior Kogi government officials, and other development partners.
Just before we go, as promised, Professor Fajolu left the number to send WhatsApp message to book an appointment for the screening of your preterm baby for retinopathy of prematurity, and the number is 091-3588-6411. Again, 091-3588-6411 for those in Lagos, Ibadan, Ilorin, and Abuja. Remember that the risk for premature birth can be lowered when a pregnant woman gets early and regular prenatal care, manage existing health conditions like high blood pressure and diabetes, and by avoiding smoking, alcohol, or drugs. That's the program for today. Thank you for sharing your time with us. I am your Me or Taigme. To stay with us on Channels TV.